Public health officials said months ago that Canadians should probably stop so heavily fixating on case numbers of COVID-19, raw case counts. Believe it or not, the very officials who were previously instituting lockdowns, they were some of the first to have said at the press conferences, okay guys, case numbers, they just don't mean what they used to mean for a whole variety of reasons. So now various health officials, such as Dr. Kieran Moore, that's Ontario's top doctor, he says you focus on the hospitalization numbers, the ICU numbers. That's the indicator of where things are with COVID. So calm down when it comes to the case numbers. In fact, he actually said the phrase, I want everyone to remain calm, at his first press conference concerning the Omicron variant that there's been a lot of discussion about in recent weeks. Now, one thing that's interesting about all of this is that this is what the health officials are saying. We're told to listen to the experts, and yet that's not being amplified all that much. It hasn't been internalized by all that many people, so we're still looking at the case numbers, and at least when it comes to Ontario, crossing back into the 1,000 cases per day threshold, still a lot of freaking out, still a lot of worrying going on about that figure, the psychology of moving from being in the hundreds to crossing over into the 1,000 number. But what does this all mean? I think we should keep in perspective that 1,000 cases now is very different than what it would have meant in previous times. During past lockdowns, you would be in a strict lockdown, and then here in Ontario, you'd see there were 3,000 or for a very few brief periods of time, 4,000 cases per day. And you go, human beings aren't even going out and about. I mean, most things are under lockdown. People aren't interacting. How are you getting this 4,000 cases per day thing? Now in Ontario and throughout most of Canada, people are pretty much doing everything. Now I know those folks who are not yet out and about in society and living like they used to live, they might see this number and get a little reticent, but I imagine the individuals who months ago said, well, everything's open, I'm just going to live my life, I got my vaccine, and now I'm just going to the movies, I'm going to the restaurant, I think they're probably less likely to see this 1,000 number and be concerned about it because they've been doing all these things that they haven't been able to do in 2 years, and, well, it's been working out fine for the overwhelming vast majority of them. Because 1,000 cases per day now, relative to the amount of human interaction that's going on, well, you wonder, is it really all that much when you're talking about most people are vaccinated? And you look at those hospitalization and ICU numbers in Ontario, and the numbers, the ICU numbers in Ontario right now at the beginning of December, are the same as they were in September, despite the fact you've got these rising case numbers going on. So there's a decoupling of it all. And there's also the fact that, well, yes, this virus during the cold weather coming into effect and during traditional respiratory virus season, cold and flu season, this virus seems to be spreading around a little bit more when you've got millions of people out and about doing whatever they're doing, meeting people for lunch or having conferences in the office and so forth, all those sort of human activities. That's what's going on here. Very different than when there were thousands of cases a day and people weren't even interacting with each other. So you go, wow, that's certainly stuff spreading there. So I think there's a lot of context and nuance to keep in mind when we see reports on rising cases in Ontario, mitigating things to consider. And like I said, not the least of which is public health officials saying, time to stop fixating on the case counts.